there, I'm Anna at VSAC, and I'm here talking with Ann Christiano, who's going to tell us a little bit more about her work. So Ann, I'll have you start by telling us your job title and where you work.
Sure. I am a pediatric nurse practitioner in pediatric endocrinology at CHAD at Dartmouth-Hitchcock in Lebanon, New Hampshire. So endocrinology is hormones. So a disease, subspecialty that diseases with hormones. So I work with kids and families mostly with diabetes in my practice.
That's great. Can you tell us a little bit more about your educational background and kind of how you came into this kind of work?
Sure. Well, it started with my dad. My dad was a physician, and I used to go on rounds with him when he went to the hospital. And when I was really young, I had to sit at the nurse's station. But I was very interested in nursing from a very young age, and he really encouraged me in that area. And then as I got older and got into nursing school, he actually let me participate in rounds. He would ask patients if it was okay if I joined him. So I really was interested in being in the medical field for a long time. I knew I didn't want to be a physician. I didn't want to be on call all the time. And I saw the long hours that my dad worked, and he did a great job balancing family and work, but I really wanted more time with my family as well. So I decided to become a nurse, and I knew early on in my nursing career that I didn't want to just do work as a registered nurse, but I also wanted to go on in my studies and become a nurse practitioner eventually. So initially, I was a registered nurse for 20 years and worked in various areas of the hospital and outpatient. I was a floor nurse, and I worked in a pediatric intensive care and a neonatal intensive care unit and on general pediatrics. And then I was a public health nurse for a while, working with the Visiting Nurses Association in pediatrics, and I was the school nurse. And then when my kids were getting older and getting ready to go off to college, I decided that I really should go back to school now before they go to college. So we didn't have 3 college degrees to pay for. And I went back and got a master's degree in nursing and became a nurse practitioner. So now for the past 20 years, I've been a nurse practitioner working here in pediatric endocrinology.
That's great. Thanks.
Yeah.
What are some of your favorite things about your job?
My favorite thing about my job is working with kids and families. I've worked with kids my whole life. Ever since I was young, I was a babysitter and I taught swimming lessons, and most of my jobs had to do with children in some way. And I always knew I wanted to work with kids. And I think that there are a lot of advantages of working with children. You see them grow and develop, and when they have a chronic illness, it's really nice to be able to help them with that. And when they're successful along with their families, it's very rewarding. So I really think that working with kids and families is probably the favorite part of my job. The part I like the least is the paperwork. And I think that's probably true of almost any job. And the paperwork part changes with time and regulations, and gets a little more complicated, but it is part of our work. And the part that I usually leave to the last.
Makes sense. Could you walk us through what a typical day looks like for you?
Sure. Every day is a little bit different, but I tend to come in early. I'm a morning person, so I'm usually in my office by 7:30. And I look at my computer and I look to see if any lab results have come in overnight or phone calls have come in that I need to respond to. If there are any new patients that have been admitted to the hospital that I might need to follow up with. I'm in charge of coordinating our diabetes program. So if there's a new patient, I have to find slots for them to be seen, usually pretty rapidly. When kids are first diagnosed, they're usually sick, so I have to get them in right away. So I look at people's schedules to find out where I can fit them in and make sure that they're seeing all the providers that they need to see. And then depending upon the day of the week, I might have patients in the clinic that I'm going to see starting in the morning. Sometimes I do it just in the afternoon. So I see patients, and I talk to them about their medical condition and what they have to do to take care of it. And we assess their medication dosages and what the challenges are. And then we try to talk about what are some strategies for getting past the challenges that they're having, making sure kids are growing and developing normally, school issues. So that, I mean, part of the fun part about dealing with kids is you're really dealing with the whole family, and you're also dealing with all the things that affect kids. So that includes their home life, it includes school life and friends and sports, and diabetes can affect all of those things. So it's a fairly lengthy visit and usually a fairly comprehensive visit. But it's, and then when you see them back in 2 or 3 months, you kind of follow up with what you did the last time and how well that's going. So it's nice to see things move along and develop and make an impact.
That's great. What do you think would make someone a good fit for this kind of work?
Well, I work in pediatrics, so if you want to work in pediatrics, you have to like kids and you have to be flexible. But I mean, I think, usually people have a basic interest in science and math. Those tend to be people that are interested in those things tend to kind of gravitate more towards this kind of field. But I know many nurses that have not, that have been more interested in the arts and in English. I think you have to have a commitment. The coursework can be difficult. Some of it's difficult, some of it's not so difficult. But once you get past the coursework and you start implementing the skills that you've learned in school, that's where really the fun begins. And there's a lot of on-the-job learning. I went to college for 4 years and took a lot of science classes and did a lot of clinicals when I was in school. And I got out of school and I got to my first job, and some physician asked me to do something. And I said, well, as soon as somebody shows me how to do that, I would be happy to do that. I mean, so kind of the hands-on learning happened a lot at the beginning of the career. And I think that some people get overwhelmed with that, but it was challenging, but it was fun. And every day you learn something new. And then as your skills build, then you start to lean on all those skills that you have and you develop more and you can do different things. I think that the exciting part about nursing is that you don't have to just work in one area. Like if you become a registered nurse and you decide you don't want to work with kids anymore, you can work with adults. Or if you don't like working in orthopedics, you can decide that you want to work in neurology, or you want to go work in the emergency room or the operating room. There's so many places that you can work as a registered nurse in the school or in the community, that you don't have to stay in one position for your whole life. So people that like change have the ability to do that, and other people that are really habitual and like to stay and do the same thing over and over again, you find a niche doing that. So there's a lot of flexibility in nursing. I think it pays fairly well on the big scale of things. So the input that you put in and the effort that you put into education and doing well, it really comes back to you. I mean, most of the places that I've worked, we got a pay raise depending upon how long we were there, but we also often get merit increases, meaning that if you're good about what you do and you put a lot of effort into it and you're committed, that you might make more money than somebody who just kind of went to work and went home and didn't really put in the extra effort. So, and not that that's bad, everybody's in a different place, but it certainly has afforded me to raise a family and do the things that I want to do. I spend a lot of time on it. I'm committed to my patients and my families and my work. So early on in my career, I brought it home a lot and worried a lot about them. I don't do that as much. I'm better at compartmentalizing and leaving some of the issues at work and not kind of worrying about them too much. And that's the nice thing about working with a team, like if I'm not here, somebody else is here and they pick up the issues that need to get attended to. So your working environment makes a huge difference. So if where you're at isn't a good fit, or you feel like you don't have a good team you're working with, then you can look for something else. And I think that's true of any career, but yeah.
That's great.
Yeah.
If a middle or high school student might be interested in this kind of work, is there anything you'd recommend that they do right now to keep exploring it, like volunteer work or classes or projects or part-time jobs?
Yeah, I mean, I would encourage them to talk to people that they know that might be in nursing. Reach out to their local, hospitals, and in the nursing department, frequently there's somebody in there that they can talk to and talk about what the opportunities are. There certainly are volunteer opportunities in all hospitals. You get different kinds of exposure depending upon what you're volunteering to do, but there are great opportunities. You can talk to your school nurse about school nursing, which can be right now it's a lot of work. And I'm sure that they would be happy to have some help. So there might be a student that wanted to help the school nurse out with some things. If people are interested in older adults, working in a nursing home or talking to people in a nursing home, there are just, there's nurses in industry, there's nurses that work in, companies have their own nurses oftentimes, or have their own health center within the company. So I would say to kind of reach out to those kinds of people and find out. I think if you're interested in the science of nursing, taking courses like anatomy, and learning about the body, or learning about how it works. There's books. I was a bibliography type person when I was growing up. I used to read a lot. I used to read all the biographies of women that were nurses, like Florence Nightingale and Clara Barton, and there are lots of different ways. So it depends on what you're interested in, but there's lots of opportunities out there.
That's great. And you spoke a little bit about your educational pathway, but what kind of education or training do you think a student should be thinking about down the road if they're?
It really depends. I mean, there are many levels of nursing. I think sometimes that's a disadvantage to nursing, but I would really encourage, if it's possible, for somebody to be in a degree program. I think that it gives you a little bit more of a well-rounded education, one, and it also, I think, gives you more power as you're kind of looking for jobs. You have a better opportunities with a degree, but it doesn't mean you have to get a degree. I know a lot of very successful nurses that don't have a degree. I know at Colby Sawyer College, which is nearby to us, we have a relationship with them, and I have patients that have gone there. So that's a 4-year degree program, but many of my patients have gotten an LPN, a licensed practical nurse degree, and you can get that in 18 months. You can do that at a community college, and then they worked as a licensed practical nurse while they were finishing up their bachelor's degree in nursing. Some people go to a registered nursing program at a community college that doesn't give you a bachelor's degree, but you might be able to sit for the registered nurse exam and have an associate's degree. And then if you want to move on there, you can get a master's degree in nursing, you can get a doctorate in nursing. Usually that's somebody that's doing research or teaching, or moving on as a nurse practitioner and doing more research in addition to seeing patients. So there are a lot of pathways to go. I would encourage students to talk to their guidance counselor at school to kind of figure out what's available. But I know Vermont Technical College has programs. I know in New Hampshire there are programs. And then, like, the University of Vermont has a registered nurse program. The University of New Hampshire has a registered nurse program. Colby Sawyer. I don't know if there's another school in Vermont too, but anyway, there are lots of opportunities, and there's a need for nurses. I think the average age of nurses right now is close to my age, and although I like to think I look younger than I am, I'm at the other end of the spectrum, so we need more nurses to take care of people like me as I get older. So there are lots of opportunities for employment.
That's great. Anything else you would want to share with students about your career?
I just think nursing is great. Being a nurse is, I think, one of the things that I'm just so happy that I learned to do at a young age and have done it for so long. And as I'm thinking about retiring, retiring, I'm thinking about how I can continue to give back to the community in some way and still maintain my license as a nurse and work as, you know, a nurse kind of on a part-time basis in another way. I think that if it's something that you think is something you're interested in, please look at it, because it's just a great profession. It really is.
That's great. Thank you so much.
You're welcome.